You're researching yoga therapy certification programs. You've probably noticed something confusing. Some programs are 200 hours, some are 800 hours. Some say accreditation is everything. Others say it doesn't really matter. And most people end up asking the same question. Which training will actually make me competent working with real clients? Because here's the reality. A certification does not automatically make someone an effective yoga therapist. And this matters because the yoga therapists who develop real clinical competence are the ones who are able to build sustainable practices and actually help their clients consistently. So in this video, I want to talk about something much more important when evaluating yoga therapy training programs, the difference between credentials and competence. And later in this video, I'll show you the framework that changed how we train yoga therapists. For those who don't know me, I'm Brant Pasalacqua. I am the co-director of Breathing Deeply Yoga Therapy. We're a school that's been around since 2011, and over the years, we've trained hundreds and hundreds of yoga therapists and supervised thousands of clinical cases with students working with real clients. We've also watched many of our graduates go on to build private practices, work in healthcare settings, and create meaningful careers in this field. And over time, one thing has become very clear. The thing that determines whether someone becomes an effective yoga therapist is not just the credential they receive. It's the clinical competence they develop during their training. Now, let me say something important. Credentials do matter. Professional standards exist for a reason. They create shared language in the field and ensure a certain level of training. At Breathing Deeply Yoga Therapy, our training pathways are designed to meet multiple professional standards. Students can earn a Yoga Alliance 500-hour certification, our foundation certification in yoga therapy, and then for those who continue to advanced training, eligibility for BDYT certification to the International Association of Yoga Therapists. These are meaningful credentials, but over many years of training yoga therapists, we've noticed something important. Two people can graduate from the same program. One becomes highly confident working with clients, and the other still feels uncertain about how to apply what they've learned. So the question is, what makes the difference? The difference comes down to clinical competence. Credentials often reflect hours of training, certificates, accreditation, curriculum requirements, but competence reflects something very different. It reflects that a therapist's ability to assess what is actually happening with a client, understand patterns within the body, nervous system, mind, unconscious mind, and design an effective therapeutic process, and then support that change over time. And that skill set is what determines whether someone becomes an effective yoga therapist. Yoga therapy is not simply about teaching poses. It's not even just about applying techniques for specific conditions, really. The real work of yoga therapy is understanding patterns within a human system. Clients come in with challenges like chronic pain, anxiety or trauma, autoimmune conditions, digestive issues, long-term movement pattern issues. But those symptoms are often connected to deeper patterns involving breathing patterns, nervous system regulation, posture and movement patterns, awareness of both conscious and unconscious mind patterns, and lifestyle factors. So effective yoga therapists develop three core abilities. The first is holistic pattern assessment, the ability to observe how breathing patterns, nervous system regulation, posture, movement, and lifestyle patterns interact. Instead of looking only at symptoms, we learn to see a whole person. And then we have skillful therapeutic design, designing practices that actually match the individual, not just applying techniques, but creating a therapeutic process that supports change over time that's beneficial for the client. And then the third is clinical experience. So working with real clients and learning how patterns evolve, because this is where confidence develops and where therapists begin to see how similar patterns show up across many conditions. So over time, we realized something important. The students who became the most confident were not the ones learning the most techniques. They were the ones learning how to apply a clear clinical framework. Most programs teach you what to do. We train you how to think clinically. And that framework became what we now call the BDYT Clinical Method. The BDYT Clinical Method is built on 3 pillars: holistic pattern assessment, skillful therapeutic design, and guided clinical practice. And this gives students a repeatable way to understand clients, design practices, and in the most efficient and useful way, support real change. Now, one thing we're really proud of is that we track outcomes across hundreds of supervised practicum cases. 86% of clients report meaningful improvement in their symptoms and overall well-being. That level of outcome reflects something important. Students are not just learning techniques, they're learning how to apply our clinical method. So a lot of our students don't come in as beginners. They come in with 200-hour certifications, 500-hour certifications. Some are even teacher trainers. They've taken multiple trainings. Some have studied therapeutic yoga. But what they consistently tell us is this: I have knowledge, but I don't have a system. They don't have a reliable way to assess someone. They're not fully confident choosing the right practices. And they're not always sure how to apply what they've learned to real conditions. And that's what changes. Students tell us their entire understanding of how to help people shifts. They go from knowing a lot about yoga to actually being able to evaluate a person, design a practice that fits their condition, and see real change. One student said to me, "I realized I thought I knew everything, but I didn't have a usable framework. Now I actually feel like I can help people." And really, that's the difference. That's exactly what we train here: a clear, repeatable clinical method you can actually use with real clients. So when you're evaluating yoga therapy certification programs, I encourage you to ask a different question, not just what credential will I receive, but will this training actually teach me how to work effectively with real people? Because the goal of yoga therapy training is not certification, obviously. It's the ability to help people. If you want to learn more about how we train yoga therapists at Breathing Deeply, we have a free set of videos and training, and you can visit the link below. We break down the full training pathway and the BDYT clinical method in detail. Thank you for listening, and I hope to see you soon.